Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Finerenone with Empagliflozin in chronic kidney disease and type 2 diabetes. Background. Limited evidence exists to support the simultaneous initiation of sodium glucose cotransporter 2 inhibitors and finerenone, a nonsteroidal mineralocorticoid receptor antagonist, in persons with chronic kidney disease and type 2 diabetes. Conclusions. Among persons with both chronic kidney disease and type 2 diabetes, initial therapy with finerenone plus empagliflozin led to a greater reduction in the urinary albumin to creatinine ratio than either treatment alone. Next article. Ciprofloxacin versus Aminoglycoside. Ciprofloxacin for bubonic plague. Background. Plague is a high-consequence infectious disease with epidemic potential. Current treatment guidelines are based on weak evidence. Conclusions. Oral ciprofloxacin monotherapy for 10 days was non-inferior to an aminoglycoside ciprofloxacin sequential combination for the treatment of patients with bubonic plague. Next article. Vepdegestrant, a PROTAC estrogen receptor degrader, in advanced breast cancer. Background. Vepdegestrant is an oral proteolysis targeting chimera, PROTAC, estrogen receptor, degrader that directly harnesses the ubiquitin proteasome system. Among patients with ER-positive, HER2-negative advanced breast cancer, Vepdegestrant was associated with significantly longer progression-free survival than fulvestrant in the subgroup with ESR1 mutations, but not in the full patient population. Next article. First-line Camizestrant for emerging ESR1 mutated advanced breast cancer. Background. Mutations in ESR1 are the most common mechanism of acquired resistance to treatment with an aromatase inhibitor, plus a cyclin-dependent kinase 4 and 6, CDK4/6, inhibitor for advanced breast cancer. Camizestrant, a next-generation selective estrogen receptor, degrader, and complete antagonist, has shown antitumor activity in ER-positive advanced breast cancer. To conclusions. In patients with ER-positive, HER2-negative advanced breast cancer with an ESR1 mutation that emerged during treatment, those who were switched to Camizestrant with continuation of a CDK4/6 inhibitor during first-line therapy had significantly longer progression-free survival than those who maintained the aromatase inhibitor combination. Next, we will be discussing articles from Journal of American Medical Association. Alteplase for acute ischemic stroke at 4.5 to 24 hours. Question. Does intravenous Alteplase administered 4.5 to 24 hours after acute ischemic stroke onset improve outcomes in patients with salvageable brain tissue and no initial plan for thrombectomy? Findings. In this randomized clinical trial of 372 patients, 40% receiving Alteplase achieved functional independence at 90 days versus 26% with standard care, a statistically significant difference, meaning in patients with salvageable brain tissue identified by perfusion imaging who did not initially receive thrombectomy, Alteplase given 4.5 to 24 hours after acute ischemic stroke onset may improve functional outcomes. Next, we will be discussing articles from Annals of Internal Medicine. Efficacy of a very low-calorie weight loss diet plus exercise compared with exercise alone on hip osteoarthritis pain, a randomized controlled trial. Background. Exercise is recommended to manage hip osteoarthritis, but weight loss recommendations are conflicting. Objective. To evaluate the efficacy of a weight loss diet added to exercise on change in hip pain. Conclusion. Adding a weight loss diet to exercise did not change hip pain but improved most secondary outcomes. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Modeling population-level impacts of cell-free DNA screening for colorectal cancer in Canada. Question: how could introduction of cell-free DNA, cfDNA-based colorectal cancer screening impact incidence, mortality, and costs of screening in Canada? Findings in this study. Modeling suggested that cfDNA screening could reduce incidence and mortality of colorectal cancer. cfDNA testing resulted in costs of CAD $234.80, US $164.06, per health-adjusted person-year gained, and could avert 0.025 deaths per CAD $100,000, US $69,874. Additional dollars spent compared with fecal immunochemical testing, meaning cfDNA testing could have a beneficial role to improve colorectal cancer screening outcomes in Canada if it improves patient uptake of screening, but would have little impact if utilization remained the same as fecal immunochemical testing. Here are the articles from Journal of Clinical Oncology. Randomized Phase 2 Study of Concurrent versus Sequential Pembrolizumab in Combination with Chemoradiation in Locally Advanced Head and Neck Cancer. Purpose: the optimal timing of pembrolizumab with chemoradiation, CRT, in locally advanced, LA, head and neck squamous cell carcinoma, HNSCC, is unknown. Conclusion: CRT with sequential pembrolizumab met criteria for further study. Immunosuppressive changes in the TME differed between arms, reflecting the impact of one dose of pembrolizumab in the concurrent arm. Here are the articles from Journal of Hepatology. A Phase IIB, randomized controlled trial of the FAR1/FAR4 agonist icosabutate in MASH safety and efficacy of icosabutate evaluated in MASH patients with F1-F3 stage fibrosis. While the primary endpoint, MASH resolution without worsening of fibrosis, was not met, improvements in fibrosis were observed. Improvements in fibrosis were also observed using two pre-specified AI-assisted digital pathology approaches. Pronounced decreases in markers of liver injury and inflammation in icosabutate-treated patients. Icosabutate was generally safe and well tolerated. Next we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Risk of gastric adenocarcinoma after eradication of Helicobacter pylori. Background and aims. Helicobacter pylori infection of the stomach is the main risk factor for gastric noncardia adenocarcinoma. However, less is known on how eradication of H. pylori influences the risk of this tumor over time, particularly in Western populations. The aim of this study was to delineate how the risk of gastric noncardia adenocarcinoma develops over time after H. pylori eradication treatment in a Western population, compared with the background population. Conclusion: this study revealed a decreasing incidence of gastric noncardia adenocarcinoma after H. pylori eradication treatment in 5 Western populations. The risk became virtually similar to the background population from 11 years after treatment. Here are the articles from Clinical Gastroenterology. Lymphocytic esophagitis, a histologic pattern of various underlying disorders. Background: lymphocytic esophagitis, LI, is a rare condition that has been reported in several case studies, but its diagnostic criteria and clinical significance are inconsistent. There are no established clinical associations, except for Crohn's disease in children. Our study aimed to determine if patients with LI have distinct demographic or clinical characteristics when compared with patients with increased intraepithelial lymphocytes, IEL, in their esophageal biopsy. Conclusion: our findings suggest that lymphocytic esophagitis is not a well-defined clinicopathologic entity, but rather a rare and nonspecific histologic pattern associated with various esophageal disorders. Further studies should aim to differentiate between the underlying causes of this histologic pattern, rather than defining it as a single clinicopathologic entity. Next we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Target trial emulation of SARS-CoV-2 infection versus no infection and risk of post-COVID-19 conditions in the Omicron variant versus prior eras. Background. Coronavirus disease 2019, COVID-19, has been linked to the development of post-COVID-19 conditions, PCCs. We investigated whether severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, infection increases the risk of selected PCCs or death up to 1 year after infection, separately in the wild-type, weight, alpha transition, delta, and Omicron eras, and by vaccination status. Conclusions. Excess burden of PCCs and mortality persisted 31 to 180 days after infection in the Omicron era, albeit at a lower level than in the weight and delta eras. Excess burden of mortality and most PCCs was much lower 181 to 365 days after infection, and was observed in the Omicron era only among unvaccinated persons, suggesting a protective effect of vaccination. Next, we will be discussing articles in the field of rheumatology. Peripheral biomarker signatures in rheumatoid arthritis-associated interstitial lung disease. Objective. Rheumatoid arthritis-associated interstitial lung disease, RAILD, is a significant cause of morbidity and mortality among patients with RA, yet effective risk stratification for RAILD is lacking. We sought to characterize unique peripheral blood biomarker signatures in RA that could improve RAILD discrimination beyond clinical and genetic risk factors. Peripheral biomarker signatures are associated with RAILD and improve RAILD identification beyond clinical risk factors. In addition to demonstrating the potential for peripheral biomarkers to aid RAILD risk stratification, these findings suggest diverse pathways are involved in RAILD pathogenesis. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Abelacimab versus rivaroxaban in patients with atrial fibrillation on antiplatelet therapy. A pre-specified analysis of the Azalea-TIMI 71 trial. Background. Combining antiplatelet therapy, APT, with conventional anticoagulants increases the risk of bleeding. In the Azalea-TIMI 71 trial, safety and tolerability of abelacimab, MA 868, versus rivaroxaban in patients with atrial fibrillation, the novel factor XI inhibitor abelacimab significantly reduced the risk of bleeding compared with rivaroxaban in patients with atrial fibrillation. Whether the safety of combination antithrombotic therapy differs in the context of factor XI inhibition has not been well characterized. Inhibition of factor XI with abelacimab consistently reduced bleeding compared with rivaroxaban regardless of concomitant APT use, with greater absolute reductions in bleeding in those requiring concomitant APT. These data suggest that factor XI inhibition may be a safe anticoagulant option in patients with atrial fibrillation requiring concomitant APT. Here are the articles from Journals of the American College of Cardiology. Using compression stockings to prevent recurrence of vasovagal syncope, a randomized sham-controlled trial. Background. Vasovagal syncope, VVS, is a common yet challenging condition with limited effective treatments. Elastic compression stockings, ECS, have been proposed as a potential therapy, but their real-world effectiveness remains unclear. Conclusions. Treating syncope with thigh-high lower limb compression using ECS did not reduce the cumulative incidence of VVS recurrence and did not change VVS-free survival. Additionally, ECS did not reduce the frequency of multiple VVS episodes. The results do not support routine use of thigh-length ECS, although it may be helpful for selected patients when added to standard care. Because our study specifically tested thigh-high ECS, future studies should aim to assess the effectiveness of more extensive compression targeting pelvic and abdominal venous pooling. From JAMA Cardiology. Cumulative Life's Essential 8 Scores and Cardiovascular Disease Risk. Question. What is the association between cumulative cardiovascular health, CVH, through young adulthood and incident cardiovascular disease, CVD, in midlife? Findings. This cohort study found that higher cumulative life's essential 8, LE8, score from age 18 to 45 years, independent of LE8 score at age 45 years, and a positive slope of improving LE8 score from age 18 to 45 years, were significantly associated with lower hazards for incident CVD after age 45 years, meaning cumulative CVH as measured by LE8 may be a useful method for identifying the highest risk young adults and targeting them for primary and primordial prevention strategies. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Trends in Osteoporosis Drug Therapy Receipt Among Commercial and Medicare Advantage Enrollees in the United States, 2011 to 2022. Context. A national assessment of osteoporosis drug therapy, ODT, use can inform the extent of underdiagnosis and undertreatment of osteoporosis objective. The aim was to describe trends in ODT use by age, sex, fragility fracture, and documented osteoporosis. Conclusion. ODT use for patients with documented osteoporosis has increased but remains low. Low rates of ODT use for patients with fragility fractures in the absence of documented osteoporosis suggests that underdiagnosis of osteoporosis contributes to underuse of ODTs. Here are the articles from Diabetes Care. Lack of validity of the glucose management indicator in type 1 diabetes and pregnancy. Objective. The glucose management indicator, GMI, is widely used as a replacement for HbA1c, but information in pregnancy is very limited. We assessed the accuracy of GMI and associations with pregnancy outcomes in type 1 diabetes. See inclusions. GMI is not an accurate replacement for HbA1c in pregnancy and women with type 1 diabetes. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Statin Initiation and Dementia Incidence in a Large Healthcare System. From 1997 to 2020, a Target Trial Emulation Study. Background and objectives. Previous research of associations between statins and Alzheimer's disease and Alzheimer's disease-related dementias, AD/ADRDs, has been limited by short follow-up, small samples, and confounding. We aimed to estimate the association between the first statin prescription and incident AD/ADRD among members of a large population-based cohort of older adults. Discussion. In this large emulated target trial, statin initiation was inconsistent with more than a 3% increase or decrease in the hazard of AD/ADRD after the first year of follow-up. This intent to treat analysis does not directly quantify effects of long-term exposure to statins. Associations in the first year likely reflect increased medical observation immediately after statin initiation. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Endotypes of Pseudomonas aeruginosa infection and bronchiectasis are associated with inhaled antibiotic response. Results from 2 randomized, double-blind, placebo-controlled Phase 3 trials, ORBIT-3 and ORBIT-4 rationale, replicate Phase 3 trials of inhaled antibiotics in patients with bronchiectasis, have produced inconsistent results. Objectives. This study investigated if different microbial and inflammatory endotypes are linked to antibiotic response in patients with chronic Pseudomonas aeruginosa infection. Conclusions. Patients with chronic P. aeruginosa have heterogeneous microbiota and inflammatory profiles, influencing antibiotic treatment responses in bronchiectasis. Future trials could be improved by patient stratification, including accounting for geographical differences and biomarkers to represent microbiota difference. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Sodium glucose cotransporter 2 inhibitor therapy and longitudinal changes in kidney function among veterans with autosomal dominant polycystic kidney disease. Key points. Sodium glucose cotransporter 2 inhibitor, SGLT2I, use has not been extensively studied in autosomal dominant polycystic kidney disease, ADP-TT. In veterans with ADPC, kidney function declined at a greater rate during the first 3 months post-SGLT2I initiation, but subsequently attenuated. In veterans with ADPD, SGLT2I versus dipeptidyl peptidase 4 inhibitor use was associated with slower long-term kidney function decline. Here are the articles from Kidney International Reports. A systematic review of treatment for acute interstitial nephritis. Introduction. Acute interstitial nephritis, AIN, is a common cause of acute kidney injury. It is characterized by tubular inflammation with eosinophils histologically. The mainstay treatment for AIN includes early diagnosis, underlying infection or systemic disease treatment, cessation of the offending agent, and corticosteroid therapy when indicated. This systematic review aims to evaluate the efficacy and safety of pharmacotherapy treatments for AIN by assessing treatment outcomes and adverse effects. TONS conclusion. Consistent evidence supporting the use of corticosteroids for treating AIN needs to be more comprehensive. There needs to be a clear consensus on the optimal treatment regimen. High-quality randomized controlled trials are required to help establish evidence-based guidelines for treating AIN.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.